see now.
Welcome to Satu Carry Online Nursing channel. Nursing is our profession, teaching is my passion. I am Satish Rajamani. Today I brought 15 questions for discussion from Obstetrics and Gynecological Nursing. These questions are solved with Rationale, and these questions will definitely guide those who are going to give nursing officer exam for AIIMS as well as staff nurse exam for ESI, and also it is going to help definitely for all those who are preparing for various nursing officer exams in various part of our country. Before going to see the questions, please subscribe to Satu Carry Online Nursing channel if you have not yet subscribed. Let's go for the first question of the day. The following parameters should be monitored when a patient is on magnesium sulfate therapy except option A, deep tendon reflexes, B, pulse rate, C, respiratory rate, and D is urine output. The right answer here, pulse rate. Let's see the rationale here. Magnesium sulfate is a drug of choice for preeclampsia. The adverse effect of magnesium sulfate drug includes muscular paralysis, which is significantly diminished knee jerks, respiratory failure, and renal failure. Nurse should monitor patient's respiratory rate because it goes to 12 breaths per minute during the time of treatment. So the pulse rate gets the least important comparing to other three options given in the question. This is referred from Datta's Obstetrics 6th edition, page number 509 and 236. Question number 2. The most common site of endometriosis is option A, ovary, B, pouch of Douglas, C, rectovaginal septum, D is sigmoid colon. The most common site of endometriosis is ovary. Let's see the rationale here. According to Mosby's Guide to Women's Health, second edition, in page number 49, we found that the following sites are in descending order the most common sites of involvement found during laparoscopy. That is, the priority goes for ovaries, next posterior queue de sac, next broad ligament, ureterosacral ligament, rectosigmoid colon, bladder, and distal ureter. Question number 3. Cardiac output is peak at option A, 30 to 34 weeks of gestation, option B, 40 weeks of gestation, C is 36 to 38 weeks of gestation, D is 28 to 32 weeks. The right answer, cardiac output peaks at 30 to 34 weeks of gestation. Let's see the explanation. Cardiac output during pregnancy is peak at about 30 to 34 weeks of pregnancy, lowest in sitting or supine position, highest in the right or left lateral or knee chest position. Return to pre-labor values by 1 hour following delivery. Question number 4. Bluish discoloration of vagina in early pregnancy is called option A, Oslander's sign, B, Chadwick's sign, C, Godel's sign, and D is Hager's sign. Bluish discoloration of vagina in early pregnancy is called as Chadwick's sign, option B. The explanation for this, Goodell's sign occurs at 6th week. The characteristic feature is softening of the cervix and bluish discoloration of cervix. Jacquemus or Chadwick's sign occurs at 8th week, which is the feature of dusky hue of the vestibule and anterior vaginal wall due to vascular congestion. Oslander's sign occurs at 8th week, which is characterized by increased pulsation felt through the lateral formices. Hager's signs occurs at 6th to 10th weeks, and former sign occurs at 4 to 8 weeks. Fifth question. Snowstorm appearance is a USG finding seen in option A ectopic pregnancy, B hydatid form mole, C PCOD, D incomplete abortion. The right answer is hydatid form mole. Question number 6. Nothing much about the rational snowstorm appearance is the common feature of hydatid-form mole in the USG diagnosis. Question number 6. Strawberry vagina is characteristic feature of option A Gardnerella vaginosis, B trichomonas, C chlamydia, D moniliasis. Strawberry vagina is a characteristic feature of trichomonas infection. Seventh question. Bishop's score includes all except option A cervical dilation, B fetal heart rate, C station of fetal head, D consistency of cervix. The right answer is fetal heart rate is not a component of Bishop's score. Let us see the other components of Bishop's score here. Bishop's score is used to predict the induction of delivery. So that time we are going to assess the fetal station, cervical dilatation in centimeter, cervical length in centimeter, cervical consistency, and cervical positions. Question number 8. The normal duration of puerperium lasts for option A 6 days, B 6 weeks, C 6 months, and D 60 months. The right answer here for 6 weeks. Let's see the rationale. Puerperium is the period following childbirth during which the body tissues, especially in the pelvic organs, revert back to the pre-pregnant stage, both both anatomically and physiologically. Puerperium begins as soon as the placenta is expelled and lasts approximately 6 weeks when the uterus becomes regressed almost to the non-pregnant state. Question number 9. Which cardiac disease necessitates elective LSCS at term? Option A ventricular septal defect, B mitral stenosis, C mitral valve prolapse syndrome, and D is coarctation of aorta. The right answer is coarctation of aorta. The rationale here, in general, there is no indication for cesarean section for heart disease. In coarctation of aorta, elective cesarean section is indicated to prevent rupture of the aortic or myotic cerebral aneurysm. Question number 10. Several minutes after a vaginal delivery, nursing assessment reveals gush of blood from the client's vagina, umbilical cord lengthening, and a globular shaped uterus. Nurse should suspect which conditions? Option A cervical or vaginal laceration, B is placental separation, C is postpartum hemorrhage, and D uterine involution. The right answer is placental separation. Let's say the rationale. Traditional symptoms of placental separation are as follows. Lengthening of the umbilical cord, uterus becomes more globular shape, uterus rises in the abdomen, descent of placenta into the lower segment and into the vagina finally, displaces the uterus upward and gush of blood occurs. Question number 11. A couple presented in outpatient department with history of infertility since last 2 years. Husband semen analysis was advised. What is WHO criterion for minimum sperm count in normal semen? Option A 10 million, B 20 million, C 30 million, and D is 40 million. The right answer here 20 million. According to WHO criteria, minimum sperm count in normal semen is 20 million. Let's see the rationale here. Sperm count or sperm concentration, to avoid confusion with total sperm count, measures the concentration of sperm in a man's ejaculate, distinguished from total sperm count, which is the sperm count multiplied with volume. Over 15 million sperm per liter is considered normal according to the WHO in 2010. Older definitions state 20 million. A lower sperm count is considered as oligozoospermia. Question number 12. A 23-year-old primigravida gravida presents with abdominal pain, syncope, and vaginal spotting. Assessment reveals that she has an ectopic pregnancy. The most common site of pregnancy is option A, ampulla, B, isthmus, C, fimbrial end of the tube, and D is abdomen. Let's see the right answer here. Ampulla. The right answer is option A, ampulla. Let's see the rationale. Most common site of implantations are mostly fallopian tubes. 95% of total cases of ectopic pregnancy. In the fallopian tubes, ampulla leads with 74%, followed by isthmus and fimbrial end of the tube, both sharing 12%, and interstitium have only 2%. So the option A, ampulla is the right answer. Most common site of ectopic pregnancy is ampulla, option A. Question number 13. Mean age for menopause is option A 40 years, B 45 years, C 48 years, and D is 51 years. Mean age for menopause is 45 years. Option B is the correct answer. Let's see the rationale. You can refer this in this particular journal which I got from PubMed. Here I have given the title of that study, Age of Menopause and Determinants of Menopause Age, a pan-India survey by AIIMS, and it is published in the year 2016, July-September, issue 7, edition volume 3, page number 126 to 131. The journal name is Journal of Midlife Health, and the date of issue is given here, and PubMed ID is also given here, 277-21640. Go for PubMed and you put this ID, the particular article will be open. You can refer the mean age of menopause in Indian women, which is 45 according to this study. Question number 14. Second degree of uterovaginal prolapse is characterized by option A, the cervix comes down to the opening of the vagina. B is the cervix is outside the vagina. C, the entire uterus is outside the vagina. And D is the cervix descends down into the vagina. The right answer is option A. The cervix comes down to the opening of the vagina. Let's see the rationale here. Uterine prolapse is described in stages, indicating how far it has been descended. Other pelvic organs such as the bladder or bowel may also be prolapsed into the vagina. The four categories of uterine prolapse are first degree, in which the cervix descends downward into the vagina. Second degree, the cervix comes down to the opening of the vagina. Third degree, the cervix is outside the vagina. Fourth degree, the the entire uterus is outside vagina. This condition is also very fatal condition. Question number 15. A 63-year-old lady presents with abdominal mass and weight loss was diagnosed as having an ovarian tumor. The most common ovarian tumor in this woman would be option A, epithelial tumor, B, germ cell tumor, C is sex cord tumor, and D is stromal tumor. Let's see the right answer. The most common ovarian tumor in the women is epithelial ovarian cancer. So here the right answer is option A. Epithelial tumor is the correct answer. Let's see the rationale here. Epithelial ovarian cancer is the most common type of ovarian cancer. Primary peritoneal cancer and fallopian tube cancer are similar to the epithelial ovarian cancer and are treated in the same way. Rare type of ovarian cancers include germ cell tumors, which is called as teratomas, stromal tumors, also called as granulosa tumors, and sarcomas. Epithelial ovarian cancer starts in the cells covering the ovaries and are the most common type of ovarian cancer. Around 90 out of 100, that is 90 percentage of ovarian tumors are epithelial ovarian tumors. The, so option A, epithelial tumor is the correct answer here. That's the end of this video. Thanks for watching Satu Carry Online Nursing channel. Please like this video and comment your suggestions and about this video. Soon we will meet with another good questions. Take care. Bye bye. Have a nice day.